Example, Danita, of how much more there is to learn about long COVID. Right now, there's no clear cause or cure for long COVID. It's estimated 30 to 40% of COVID-19 patients will experience at least one symptom a month after initial infection. All three major hospital systems here in Northeast Ohio have dedicated clinics to treat long haulers. The one at Cleveland Clinic has been open a year now. The push for answers isn't slowing down there, and neither is the patient population.
How long is this going to last? When am I going to get better? Am I going to get 100% better? Those are all the things that run through my mind every single day.
Hinda Stocksdale is a COVID-19 long hauler. Life changed for her in December of 2020 when she went from a healthy 30-something with a future as bright as her smile to nearly bedridden with pain and despair.
The symptoms just never changed. It felt like every day I had COVID.
Her symptoms are head to toe. She's fighting tooth and nail and says healing finally began after months of suffering.
Had you not found your way up to the Cleveland Clinic,
I think I would have lost my mind.
A lot of the patients who come to us are frustrated.
Dr. William Lago is the medical director at Cleveland Clinic's Recover Clinic for COVID long haulers, where they're treating about 125 new patients a month.
They feel like no one really understands what's wrong with them.
Dr. Lago says confirming to the patient that long COVID is real, their symptoms are real, and so is hope for healing is most important.
Our goals right now are trying to get people back to functioning normal lives.
They do that by trying to improve symptoms. The most common, they say, are fatigue, brain fog, and shortness of breath.
For me, I think some of the neurological symptoms are the most perplexing.
Brittany Ballone is the clinical lead at the Recover Clinic. She says 60 to 70% of the people they treat are women, and their largest patient population is people ages 40 to 50.
Everybody's journey with this is unique, with the way that they present, with the way that they heal and move forward.
Healing is happening, including for Hinda.
My improvement isn't a linear or straight line progression. I get better. And then I seem to regress back, and then I improve even more.
Hinda also found healing in online support groups, where she tells me there's a tsunami of people and emotions.
Anger, because some people who are long haulers feel that they did everything right, and unfortunately they still got sick. Feeling misunderstood.
Hinda still has a list of health complications. She'll keep fighting and says she shares her story to encourage others to do the same, and for us all to have empathy for each other.
I have a lot of fire. I have a lot of tenacity. I call myself a firecracker long hauler because I don't give up.
Wow. And she needs that. She was amazing to talk to. Dr. Lago says it's certainly not unheard of to see reactions from a viral infection, but the scale and scope of what we're seeing from COVID, that is unusual. That is different.
Yeah, I love when the patient said, these long haulers, this is real. This is not something that's just in their mind. Have they seen anything different with we had a lot of waves of the pandemic. Did they notice anything?
I did. I asked them about that, and they said, so far they're not seeing anything specific yet to the different variants. They also say that they see people who had a very mild initial COVID infection and those who were severely ill both go on to develop long COVID.
Any impact with the COVID vaccines at all?
That's interesting too. They tell me they are seeing both unvaccinated and vaccinated patients. Now the CDC says the best way to prevent long COVID is to prevent getting COVID-19 in the first place. And they say the best way to do that right now is with vaccinations for those who are eligible.
Now, we've been reporting about people who have these long haul symptoms, and there are clinics available. How do people get into those?
Yes, so here with the Recover Clinic, you do need to be referred by a Cleveland Clinic practitioner who identifies that you meet the criteria that we talked about. You're at least a month out and you have these symptoms. A lot of people, they don't have, what the gold standard, right? The PCR test to prove that they actually had COVID. You remember, testing was not widely available or accessible for a very long time. Like Hinda, she was sick in 2020. Don't let that be a barrier if you don't have a PCR test in getting help for long COVID.
Katie, I can hear the people out there this morning are saying, will my insurance cover it?
Right. Cleveland Clinic tells me that health insurance companies do recognize the diagnosis of long COVID, and they cover as they do others. The Cleveland Clinic also says they have programs to help cover medical costs for people without insurance. They say patients can speak with a financial counselor before visiting the Recover Clinic to talk about this kind of help. Danita, bottom line, what they really want to stress is they want people to know long COVID is a legitimate medical condition and to seek treatment.
Yeah, and it is available.
It is available. And like Hinda said, if you don't get it at the first, seek a second opinion, seek a third opinion until you can get the help that you need.
And I like Hinda. She